So hi, everyone. My name is Telmo Santos, and I'm a general pediatrician at Cohen Children's Medical Center of Northwell Health in New York. And I'm currently also enrolled as an MPH student at Hofstra University in my last semester of the program. Thank you guys all for attending the webinar, and I'm looking forward to sharing some of the work that I've had the opportunity to be a part of over the past couple of years. As you can see, our study team is comprised of members from many different backgrounds located all throughout the US. And part of our research involves the investigation of caregiver support, burden, and long-term care planning among caregivers of individuals with intellectual and developmental disabilities, or as you guys may hear me say intermittently, IDD. Oftentimes when the term long-term care planning is heard, it's associated with end of life, like planning or thought of as end of life planning. But long-term care planning really encompasses much more than that. Because individuals with intellectual and developmental disabilities may require lifelong assistance with basic and instrumental activities of daily living, long-term care planning is particularly important. So incredible progress has really been made in terms of the care and management of individuals with chronic medical conditions, including IDD. And with this, there's been an increase in the life expectancy of individuals with IDD, and it's therefore really important that we start to identify and address potential challenges that these individuals and their aging caregivers and family members may face in the future. Many individuals with IDD ultimately have been outliving their caregivers because of this increased life expectancy, and they may need lifelong assistance with, again, things like basic activities of daily living, and many of them actually age out of critical educational and insurance coverage programs and benefits. So long-term care planning is absolutely necessary, but it's challenging. It encompasses a broad range of paid and unpaid medical and personal care assistance that may be needed as a result of a disability. And as one can imagine, there are many moving pieces and many people involved in this type of planning. And it really requires in-depth knowledge and navigation of long-term services, things like Medicaid waivers, and other medical and social service systems and programs. So primary caregivers really play a central role in helping individuals with IDD with their daily needs and with planning for the future. But engaging in such a sensitive topic like long-term care planning is difficult and emotional. And we really need to further investigate it so that we can ultimately help support these families and the care recipient. It's not surprising that previous literature has demonstrated an increased prevalence of depression among caregivers of individuals with IDD. But thankfully, caregiving has really garnered attention as a public health concern, and it's kind of come into one of the spotlights, thankfully. So our primary research objectives were to establish the level of progression through long-term care planning, and to compare if the degree of planning was higher in the presence of various types of support systems that we'll go into among family caregivers of individuals with IDD living in parental homes. And our secondary research objectives were to identify the prevalence of burden among caregivers of individuals with IDD, and to examine if burden is lower in the presence of caregiver social support. So our study team conducted a cross-sectional survey from October 1st, 2019 through June 3rd, 2021. And it was distributed through IDD advocacy groups and large academic hospital systems in New York, Ohio, Pennsylvania, and Texas. And these are all academic systems that have similar interests and that we have a previous relationship with as well. And eligible participants were caregivers over the age of 18 who, again, were taking care of an individual with IDD at home. So to better understand caregivers and the care recipients, we collected demographic information, and that included things like caregiver age, gender, race, and ethnicity. And then we also collected information about the caregiver relationship to the care recipient, whether they had established legal guardianship status, for example, and socioeconomic characteristics that included things like level of education and the annual household income as well. So our team wanted to investigate caregiver health and burden as well, and we incorporated frequently used and validated measurement tools. And I'll give a brief description of each one of these, and I'll kind of remind us a little bit later as well of some of the scoring systems, because I know there's a few involved here. But so caregiver physical and mental health were assessed, and this is going to be a mouthful, and I'll give you guys the acronym, but using the National Institutes of Health Patient Reported Outcomes Measurement Information System Global Health Measure, but I'll just call it the NIH PROMIS measure or the PROMIS score. And it's a 10-item questionnaire that we use to produce two separate scores, one for global physical health and the other for global mental health. And what those scores allow us to do is we were able to generate a standardized T-score so that we can compare T-scores with the general population in the United States. Burden was evaluated using the Zarit Burden Interview Short Form. It's also, sometimes abbreviated as ZBI-12 or the Zarit Burden Interview. And it's a validated 12-item questionnaire. Participants are asked different types of questions, such as, do you feel that because of the time you spend with your relative that you don't have enough time for yourself? And answers range from, for each question, it range from 0, which corresponds to never, all the way up to 4, meaning nearly always. And total scores ultimately range from 0 to 48 on all 12 questions, with higher scores indicating a greater degree of burden. Our study team used a score of 12 as the cutoff between low and high level of burden. And we got this score based on a secondary analysis of 4 studies that had been published that included caregiver populations taking care of care recipients with 3 different types of advanced chronic conditions. And then finally, caregiver stress was assessed using the Holmes-Rahe Stress Inventory Index. There's not a really good abbreviation for this one, unfortunately, but it's caregivers in this measurement indicate whether they've been faced with any of 43 different life stressors within the past year. And then each life stressor carries a unique weight with it that contributes to a composite score, with greater scores ultimately indicating a higher likelihood of experiencing a stress-related illness within the upcoming 2 years. To understand the care needs of individuals with IDD, our survey used the validated Weissman Activities of Daily Living Scale, or WADL, to assess those daily living skills and functional independence of the care recipients. And in this measurement, caregivers report the care recipient's ability to perform 17 different activities. And again, they use a Likert scale from 0, meaning does not do at all, to 2, which means independent, or the individual does this on their own. Another major focus was to better understand caregivers' progression through long-term care planning. And our survey included a long-term care planning item set. And this item set had been previously developed based on results of a qualitative study that the study group had done with parents and adult siblings of individuals with intellectual and developmental disabilities. And listed are some of the domains of the long-term care planning set. So a few examples of those are, medical or healthcare supports. Are there housing supports in place? Do they have transportation services set up and already in place? Do they have other types of family support services? Have they been saving money for the care recipient's needs, and so on? And long-term care behaviors were assessed also on a 5-point Likert type scale, ranging from 1, meaning I do not need to plan for this, all the way to 5, where they have a plan completed or already set up. And services were subsequently averaged, and then greater scores indicate greater progression through long-term care planning. One of the other big parts of the study as well was assessing caregiver support systems. And in particular, one of the big things is we inquired about the presence of social support, which we defined as an additional individual who could assist with care recipient needs in the event that the primary caregiver was unable to do so. And that source of social support really may encompass relatives of the care recipient or even an unrelated individual. We also wanted to investigate involvement in different types of informal system supports like school-based services, advocacy support groups, local respite services, or faith and church communities. And then similarly, we wanted to investigate involvement in formal system supports as well. So a few examples of those would be, government-funded health insurance, respite care, adult day programs, and Medicaid waivers, for example. And then the mean numbers of current informal and formal system supports were subsequently calculated, and we'll go over those things as well. So ultimately, 405 caregivers completed the survey throughout the 4 various states. The mean caregiver age was 53, but it ranged anywhere from 22 to 84. And we found that the majority of participants were caregivers who were predominantly parents, legal guardians, white, non-Hispanic, and female. And the caregiver sample was highly educated, with almost 2/3 reporting having achieved a bachelor degree or higher. And in addition, more than 1/3 of participants had an annual household income of $100,000 or more. The NIH Promise Measure score for the mean physical health was 44.5. And then the mean mental health score was 46.3. And what those mean compared to the US general population is that they're actually slightly lower, where the US population's T-score has a mean of 50 with a standard deviation of 10. So we could see that our caregiver samples scores for both of those, again, were slightly lower comparatively. Unfortunately, it's not surprising that caregiver participants in this study also reported a high degree of burden, with that mean Zarit burden score being 19.8. And if you recall, the scores of 12 or above are what we considered a high level of burden based on a previous, secondary analysis. And then the average caregiver stress inventory index score was 152.9. So what this really means, because the scores can range surprisingly anywhere from like 0 to over 1,000. But what this score indicates in particular is that there's about a 50% chance of stress-related illness occurring for that caregiver within the upcoming 2 years. The mean long-term care planning score was 3.2. And this is, again, on a scale of 1 to 5. So 1 meant I don't need to plan for this. 5 meant I have a plan complete for this, or I already have this service set up. And what this corresponds to in particular is that overall, the caregivers were in the quote unquote learning to plan phase for long-term care planning needs. Unfortunately, less than 40% of caregivers identified a source of social support, which again was defined as an additional individual who could assist with care recipient needs. And the most common was another parent or legal guardian. One of the areas we really wanted to focus on was the impact of social support. And we were excited to find that there was an association between caregivers who identified a source of social support in that they were found, they were associated to have progressed further along in long-term care planning. So that was 3.4 versus 3.1 on that scale of 1 to 5, with a significant p-value of 0.009. And similarly, caregivers who identified a source of social support also reported lower, or also were associated with, I should say, having lower caregiver burden scores. And those scores were still above 12, but there's a significant difference as well. Whereas the people who were able to identify a source of social support had a Zarit score of 16.3 compared to 23.6, again, with a significant p-value of less than 0.001. The mean number of formal system supports reported was 3.3, with the three most common being federal health insurance, a form of monthly cash stipend, and then Medicaid waivers as well. And this next slide is more of just a graphical representation of those to make it a little bit easier on the eyes. But again, if you focus on the bottom three, those were the top, most frequently used formal support systems. The mean number of informal system supports reported was 3.4, so very similar to formal supports. And in this case, the three most common were friends and family, school-based services, and then online communities or forums. And then on the next slide, again, we have just a graphical representation of this with, the focus being on, like the ones listed at the bottom, which were the most frequently used informal system supports. And we also found that engagement with formal and informal system supports were found to be predictors of long-term care planning, with informal system supports having an associated unstandardized beta of 0.04, and formal support systems having an associated unstandardized beta of 0.05. Although the most personally challenging aspect to caregivers was reportedly managing the emotional or mental distress of caregiving, receipt of mental health support was only reported by less than a third of caregivers, unfortunately. And then finally, we performed a multivariate analysis as well, and it demonstrated that factors such as social support, white race, older caregiver age were all associated with lower caregiver burden scores. And on the other hand, this multivariate analysis demonstrated that greater caregiver burden scores among caregivers with education beyond the high school or GED level, and among those that had more formal system supports in place for their loved one, again, were associated with greater caregiver burden scores. So we know that the positive impacts of social support on mental health and well-being, it's been well established in the literature in the past. And our study really supports that the presence of a source of social support among caregivers of individuals with intellectual and developmental disabilities may even serve as a driver for caregiver progression through long-term care planning. So previous results from a literature review of families with individuals with a learning disability and a recent systematic review among individuals with intellectual and developmental disabilities showed that the emotional toll of associated with planning for the future was identified as a huge and one of the major hindrances in engaging in long-term care planning behaviors. So among participant caregivers in our current study, it may be that the presence of social support really was key in addressing some of those emotionally difficult and sensitive topics of long-term care planning and its associated uncertainties. And a caregiver's social support system may also promote long-term care planning behaviors by, even serving as a sounding board, for example, as they navigate through some of the painful decisions associated with it. The benefits of caregiver social support even extend beyond the association with long-term care planning progression. So in this study, again, it was found that participants who identified that source of social support were also associated with having less caregiver burden. So this, supports previous literature of caregivers of adults with taking care of individuals with autism, in which they found that social support was a mediator of the relationship between caregiver burden and quality of life. So in addition to the association with social support and progression through long-term care planning, both informal and formal system supports were found to be associated with planning behaviors. So developing, this a multifaceted support network that really includes these different types of supports may address two big barriers in planning that have also been identified in the in previous literature, which are lack of information and inertia as well. So from a clinical standpoint, it may be important for medical providers of individuals with IDD to have a conversation with caregivers regarding the types of support systems that are in place and to screen for factors that might be related to a higher level of caregiver burden. And medical providers can then really engage other members of the care team, like social workers and care managers, who can then link caregivers with resources for mental health services, resources for developing social support networks, and joining caregiver support groups, all of which are particularly important, especially in the midst of the ongoing COVID-19 pandemic. Our findings demonstrated that the most common formal system supports are those which are federally funded. So this really emphasizes the importance of advocating for the expansion or at least maintenance of these programs, as well as continued efforts to bolster those outreach initiatives throughout the different states to identify eligible recipients and then provide education about eligibility requirements and really help facilitate enrollment in the processes as well. There were a few limitations to the study. So we did, surprisingly, throughout the 4 states, we had a relatively homogeneous convenience sample. So again, everyone was fairly, well-educated, identified as female, Caucasian, with an overall high household annual income. And then distribution of the survey occurred, both before and after the start of the COVID-19 pandemic. But what our team hypothesizes is that, even though we see like how, how much families in general are struggling, even, before the COVID-19 pandemic. So we could only imagine that things have gotten even tougher for families. And again, these families are generally, have like a very high overall household income and are very well educated. And even so, there's still these struggles. So we imagine that, other families who may not have the same type of resources and who may not come from the same types of socioeconomic backgrounds may be faced with even tougher challenges than our caregiver population that we surveyed. So some of the future steps that the group is taking is we've actually learned from the success of one of our collaborators, Dr. Lee Lindquist, and her team. She actually developed an online planning tool that's available for seniors. And following in her footsteps, we're trying to create a similar, like online, widely available tool that families with individuals with IDD can use to really plan for that, the different aspects of long-term care planning. So that was just the, like the sign-up sheet, but we're looking for, we're carving out like different sections of this based on the results and based on previous qualitative studies as well. So some of the sections that we've carved out so far are like applying for Medicaid waivers, for example, helping families navigate what it's like enrolling for medical decision-making processes, evaluating again caregiver support systems, like which ones are in place, and then overall caregiver well-being. So one of the tools that we've incorporated into it is one of the commonly used depression screening tools, the PHQ-2. So we have, the caregivers take this, depression score, and then, if they score beyond if they score a concerning score, we urge them to bring it to their primary care physician as well to make sure that they're also taking care of their own, mental needs as well as their own physical needs as well. And again, thank you guys so much for attending. I have my email there if there are any questions, and I'm also happy to take any questions as well from the group.